Welcome to the Wraparound Training Series, designed to assist individuals, organizations, and communities with the implementation of high-fidelity wraparound. My name is Julie Radlauer-Dorfler, and I'm with the Soc Wraparound Group. My role is to assist the Department of Children and Families with the statewide implementation and scaling of high-fidelity wraparound. This training series offers support to those intending to provide wraparound to youth, families, and adults living with behavioral health conditions. The material presented here is representative of years of practice and experience of the Soc Wraparound Group, the research and writing of Vroon Vandenberg, and the framework and guidance from the National Wraparound Initiative. This video series is designed to accompany live training and is intended to provide coaching support in the field to assist those implementing wraparound. Enjoy the video. Welcome to What is Wraparound? This video will provide you with an overview of the wraparound process. As you can see from the logos listed on this page, wraparound is a collaborative process designed to assist individuals, youth, and families. The wraparound process provides a supportive framework where people struggling with behavioral health conditions can receive support to have a better life. My name is Julie Radlauer-Dorfler, and I'm with the Soc Wraparound Group. I'm here today to speak with you about the wraparound process. Currently, we have a contract with the Department of Children and Families to support the implementation of wraparound across the state of Florida. The state of Florida has made a commitment to mental health transformation. Through a statewide system of care grant, we have been able to expand system of care values and the wraparound process. Uta Gatioch is the Director of the Substance Abuse and Mental Health for the Department of Children and Families. She is a champion of the wraparound process, as evidenced by this quote. Recovery-oriented systems of care are networks of formal and informal services designed to provide an avenue for long-term recovery for individuals and families impacted by behavioral health conditions. The elements of the recovery-oriented system of care process promotes community integration, family involvement, peer support, collaboration and partnership. Informal support for sustained recovery is driven by data and utilizes strengths to provide hope for a better life. While the recovery-oriented system of care is used to address the overall system for both adults and children's, the children's system further defines some specific yet similar values. The values of a system of care are driven by research through Friedman and Stroll and must include the above-mentioned values. The relationship between system of care and wraparound is easiest stated as they share common values and guiding principles. However, systems of care refer to how systems work together, while wraparound addresses the practice level of care. This slide represents the wraparound movement. The slide is based on the first few cohorts of system of care grants across the United States. These grants came out of SAMHSA and started the system of care movement. The dots represent system of care grants in the early 2000s. Fast forward 10 to 15 years and you see the progression of the wraparound process across the United States. The blue states represent statewide implementation of wraparound, while the yellow states represent a state that has one or more wraparound initiative within that state. It's noteworthy that as of 2018, every state in the United States has evidence of wraparound. Wraparound has been implemented across the state of Florida since the early cohorts of SAMHSA's system of care process. Since that time, wraparound has expanded across the state of Florida and within the last few years has exponentially grown with the implementation of the statewide system of care grant process. In this slide, you can see how both SAMHSA and the Department of Children and Families has supported the implementation of wraparound through CAT grants and system of care grants. This slide represents the number of people trained and coached prior to January 2018. Through the expansion of this process, the Soc Wraparound Group has trained over 300 additional people, and we're tracking and updating the numbers of these people certified on a monthly basis. In order for wraparound to truly be successful within communities, there has to be support at the systems level through system of care work, at the organizational level through the technical assistance with organizations to support the implementation, and at the practice level through team-based interventions with families. Having an understanding of the prevalence of the mental health and substance use conditions provides a framework for determining the utilization of practices such as wraparound. In this slide, the green part of the triangle represents 80% of the population. This is considered the at-risk population, and typically systems spend about 5% of their dollars on prevention efforts for this population. The yellow part of the triangle represents 10% of the population, and we consider this population to be emotionally disturbed. Currently, most systems spend about 35% of the dollars on this population. The top red portion of the triangle represents anywhere from 2 to 5% of the population. These tend to be our most complex consumers. Unfortunately, most systems spend up to 60% of their dollars on just 2 to 5% of the population. The goal with wraparound is to intervene earlier in people's lives and provide less costly interventions. By doing so, the dollars will provide services for more of the population. So what is wraparound anyway? It's a process that focuses on the strengths, needs, and cultures of a person or family, and then utilizes those strengths to help people meet their needs. The process is driven by the client, and it's a teaching model whereby people learn new skills so that they can support themselves in the future. These are the principles of the wraparound process. Here's a description of each of the principles. Voice and choice. The youth and family or individual is guiding the process. Culturally competent, really understanding the family culture. Individualized. Different interventions are used for different people based on their skills, talents, and interests, as well as their needs. Strengths-based. We're focusing on things that people like, what they're good at, as well as their talents and interests. Unconditional care speaks to the persistence on behalf of the case manager with the client. Natural supports refers to family, faith, and friends. Community-based. Receiving support where people live in the least restrictive setting and convenient in the lives of people. Community-based means that people are receiving support where they live in the least restrictive setting and when it's convenient for their lives. Team-based, wraparound is a team-based approach, so having all the right people at the table. Collaboration and integration means that we're working together in a comprehensive planning process. The goal is to have one plan and to ensure that all plans match and do not duplicate. And then outcome-based, which means we're paying attention to the effectiveness of services and improvement of clients' lives. This slide represents the value of natural supports. Now what I'd like for you to do is take a moment and think about the biggest crisis that you've had in your own personal life. And then I want you to think about how did you get through that crisis. How many of us got through the biggest crisis we've ever had in our own personal life through the assistance of our friends? How many of us got through that crisis through the support of our family? And then how many of us got through the crisis with the support of our faith? Now ask yourselves, how many of us got through the biggest crisis we've ever had in our entire life with the support of a paid professional with an advanced degree? So most of us get through our crises through the assistance of our faith and our friends and our families. And then we really have to ask ourselves, why do we think that the families that we're working with can only get through their biggest crisis with the support of us, paid professionals with advanced degrees? That's why it's important to have faith, friends, and families involved in the wraparound process. This is an overview of the wraparound process so that organizations and systems understand what the wraparound process looks like. Here we explain why coaching is an important piece of the wraparound process. If you sat in a training, you would increase your knowledge by 10%. But when you go to use that knowledge in the field, you would actually use 0% of that newfound knowledge. If you sat in a training and during the training you demonstrated some new skills, you would increase your knowledge by 30%. Again though, when you go into the field, you would practice 0% of your newfound knowledge. If during that same training you actually practiced the skills and received feedback, you would increase your knowledge by 60%. And then when you went into the field, you might use 5% of your newfound knowledge. However, if you sat in a training and received theory, and you also saw the demonstration of skills and practiced and received feedback, and then finally somebody came into the clinical setting with you, so somebody goes into the home, you will increase your knowledge by 95%. And then you will also increase the use of your newfound skills by 95%. That's why Wraparound uses a coaching model. It's important to understand the rollout and implementation of the Wraparound process. When the federal government began expanding Wraparound, they wanted to standardize the process to ensure that Wraparound in Florida is similar to Wraparound in Alaska, which is similar to Wraparound in New York, which is similar to Wraparound in Oklahoma. Having said that, in true Wraparound form, the process can be individualized within communities. In order to accomplish the standardization, the National Wraparound Initiative was created. NWI is an online resource designed to support the evidence base of Wraparound and the implementation across the United States. So in your free time, go check it out and Google the National Wraparound Initiative. So, what does all this research on the National Wraparound Initiative say? There are over 217 research articles representing wraparound research, and some of the outcomes promote increased permanency, decreased restrictiveness of residential, improved school and early care outcomes, increased child and family protective factors. This slide explains a comparison study conducted in Nevada. In this study, the research team is comparing telephonic case management to traditional targeted case management to high-fidelity wraparound. The tool that was used to support the research was the CAFAS, the Child and Adolescent Functioning Assessment Scale. The CAFAS is a 360 assessment tool that's completed by the parent, the child, the case manager, and other people on the team. The results are compiled and reports the overall functioning of the child. The lower the CAFAS score, the better the functioning of the child. In the slide, you can see that the control group, which represents telephonic case management, does support improvement in functioning by 4.4 points. Intensive case management, which is typically targeted case management, shows even more improvement with 7.5 points. When you look at the results of Wraparound, you see that the CAFA score improves by 28.5 points. This change is considered statistically significant because the difference between an at-risk and emotionally disturbed or an SED or EBD child is 30 points on the CAFAS. So by implementing Wraparound, we're taking children out of clinical range and helping them make significant changes to their lives. This slide, which is also provided by Vroon Vandenberg and the National Wraparound Initiative, is a comparison study where we're comparing high-fidelity wraparound to low-fidelity wraparound or traditional targeted case management. In Wraparound, we're teaching people skills and how to access support systems. And in low-fidelity Wraparound, we're typically doing the majority of the work for the clients, taking them places or completing referrals for them. We're using the CAFAS again as the measurement tool. Both groups begin at roughly the same CAFAS levels. However, when you look at the 9 months, which is typically graduation for this study, you will notice that at 9 months, the low-fidelity group is actually functioning a little bit better. When you look at the CAFAS score 3 months later, what do you see? The low-fidelity group is functioning worse than when the study started. What do you notice about the high-fidelity group? They're functioning better. The reason that this happened is because the low-fidelity group, we did everything for them. So when they had their next crisis, they didn't know how to function. However, with the high-fidelity group, because of the teaching model, they learned how to ask for help and seek support when they needed it. Now let's look at some other functional outcomes. This data is from Broward County. The first bar represents pre-Wraparound in the community, and there were 192 children in residential out-of-home care. Wraparound started in the community 1 year later. When you fast forward 7 years to 2010, you see that there are 137 children in residential, and then another 7 years later to 2017, the number of children in residential is down to 52. The implementation of Wraparound provided a community alternative to children needing residential treatment and decreased residential services by 73% over a 15-year period. Now let's talk about the key players in the Wraparound process. The youth and family are the most important people in the process. Remember, family, voice, and choice. Another important member on the team is the family or the youth partner. This is somebody that has had lived experience with the similar challenges that the youth and the family are experiencing. The case manager is the person that facilitates the wraparound process. It's noteworthy that the case manager carries out limited tasks on the plan. This is because the team should learn how to support the family, because one day a case manager will no longer be working with the family. So the team needs to learn how to support the family, and the family needs to learn to rely on their natural supports. System partners are also very important in the wraparound process. And listed here you can see some of the system partners that may be involved in wraparound. This is a slide that talks about a TED Talk that's conducted by John Vandenberg. We're not going to watch the TED Talk because it's about 15 minutes, but if you just Google YouTube and TED Talk, you'll be able to watch the slide, or you can use the link above. I highly recommend that you watch this TED Talk. So in closing, a person without support looks a lot more like a person in need of treatment than a person with support. Thank you for your participation.